All right, so let's talk about different parts of the brain. Okay, we start off with the front of the brain, and that is called the cerebrum. The cerebrum is where we have our logic, our critical thinking, our brainstorming. It's also a place where we have memory, judgment. We have some voluntary body movement from there, smell and hearing. So you're going to realize that whatever part of the brain that is either injured or affected by Alzheimer's, we're going to have the resulting effects from whatever part of the brain that has been affected. So, in other words, if you have a frontal head injury and it injures that part of the brain, then we're going to have problems with critical thinking. So, we have to think that a lot of our dementia patients that we see in the nursing home do have a lot of that cerebral area of the brain that has problems with being affected. Okay. The next part of the brain we have is the cerebellum. Okay, now I always think of shaking a bell. All right, what do we have to do to shake that bell? Well, there's muscle movement involved. Okay, and there's balance. So those are the areas that are we think about with the cerebellum. It's the section right below the back of the brain, and it also involves muscle tone as well. Okay, I can't blame my muscle tone on that area of the brain, though. It's just from not exercising. The diencephalon. The diencephalon is the section of the brain located between the cerebrum and the midbrain. And here we have an area that contains two important structures that we don't often think about, but they're really, really important to our everyday lives. We have the thalamus and the hypothalamus. The thalamus is involved in pain and temperature control. So a lot of times if you have a patient that has a brain injury and that part of the brain has been affected, their temperature might be spiking way, way, way up or down, one or the other. We also have the hypothalamus, which involves temperature, appetite, blood vessel constriction, water balance. Okay, it also is our emotional center. So some of the patients who may be more aggressive at the nursing home or maybe are acting inappropriately sexually, that part of the brain has been affected by the dementia. Then we go on to the midbrain, and the midbrain is at the top of the brain stem. Okay, so it's responsible for conducting impulses up and down from the lower part of the brain up to the top part of the brain. And certain eye and auditory reflexes are responsible in that midbrain area. We also have the pons. The pons isn't something that we often think about. It's located right below the midbrain and then also just within that top of the medulla oblongata, which is otherwise known as our brain stem. And this area is responsible for conducting messages again up and down, also tasting, chewing, and saliva production. And then we go down to the base of the brain, which is the medulla oblongata, and sometimes they just call it the medulla. And that is our connection from the brain to the spinal cord. This is the center where we have our respiratory control. There's some temperature control involved, blood pressure, those key vital signs that we have to maintain for life. And if we have an injury in our cervical area, you can see why that's a problem when someone has a broken neck. If that area of the medulla oblongata is being compressed or injured and it's not able to pass those signals up and down to the brain, then we have major problems with people having to be on a respirator. Blood pressure can't be maintained, those types of things. So the medulla area is extremely, extremely important. Then we go down to the spinal cord, and the spinal cord is a series of nerves which relay information up and down to our brain from those afferent and efferent nerves in our peripheral or other parts of the body. The brain and the spinal cord are protected by three layers called meninges. All right, so there's three types of meninges. There's the dura mater, which is your durable or harder outer covering that protects the spinal cord. We have the middle section, which is your arachnoid, and then we have the one which is closest to the nerves, the most innermost part of the meninges, which is called the pia mater, and that serves for the nourishment and the blood vessels of the nerves to be passing back and forth in this covering. The brain has 4 ventricles, which are hollow spaces within each, and they have a space inside there. And this space is filled with cerebrospinal fluid. This fluid is in our brain and it also brain area, and it also goes down to our spinal cord. And sometimes you might hear a test. I believe a couple of you in the class have had this, a lumbar puncture. A lumbar puncture is when you have someone in a very crouched fetal position, arching their back up, and they put a long needle inside the spinal area of the lumbar area, which is that lower back. They puncture and they go in and they aspirate or draw out some fluid. They take that fluid, CSF, otherwise known as cerebrospinal fluid, they send it to the lab and they check it for infection. So sometimes you might hear someone has meningitis. They probably have had a lumbar puncture. If you have someone with encephalitis, which is inflammation of the brain, they most probably have had a lumbar puncture to test. I've helped the doctors many, many times with this type of exam. You have the patient kind of bend over in bed over their bedside table, so that kind of arches out the back. It does cause a little bit of discomfort, but one of the things you have to remember is afterwards they need to be supine for a couple of hours, because patients can suffer severe migraines after having a lumbar puncture. So they have to stay still and lay flat, otherwise it can cause a lot of headaches. So we talked a little bit about the sympathetic and the parasympathetic system in the prior video. Just remember that fight or flight response is what keeps our body in that homeostasis, in that balanced state. So when we're stressed out, our sympathetic system goes into gear, and then once everything cools down and we're relaxing, it's the parasympathetic system that kind of brings us back to the normalcy of our vital signs and everything. So we're pretty lucky Mother Nature has given us these checks and whistles so that we can survive life every day. Okay, I have to think, like I said before, that our sympathetic system has been on overdrive lately because we have been stressed out quite a bit. Bye, guys.